Great. So we're recording. So hey everybody, I'm Laurie Convay, and I'm actually a practicing dental hygienist in Ontario and also an entrepreneur. But with my travels along the way in Bruce County especially, I have a really amazing opportunity to meet a lot of business women. And one of them is Janice Taylor, who is a physical therapist in Port Elgin, Ontario. And Janice, I really just wanted to promote your business because of the vast amount of education that you provide for women, honestly men too, but for women especially. So can you tell us a little bit about your education and your business as well?
For sure. So thanks for having me on, by the way. So yeah, I'm a pelvic health physiotherapist. I work in Port Elgin. So my education is it's pretty typical of any physiotherapist. I went to McMaster for kinesiology, and then I did a second degree in physiotherapy right after that. And so originally I practiced in orthopedics, which is what a lot of physiotherapists do. So like knees, hips, shoulders, all that. And then when I was having my children, and also I had an interest in pediatrics as well. So when I was having my children, I actually did pediatrics for 10 years. But when I was pregnant with my second child, I developed a prolapse during that pregnancy. And of course, as a physio, you always want to do your own research. So I was reading into all this stuff on pelvic health and prolapse, and I was upset that no one told me that this could happen, and I was in the healthcare profession. So I ended up realizing it can't just be me and taking a whole bunch of courses in pelvic health. And I started working in 2011 doing pelvic health, and I just keep on taking courses. I keep on learning, and I've been doing that for 9 years here in Port Elgin. So yeah.
Wow, that's actually really amazing and such a great story as to how you kind of came into what you do and what your passion
Mhm.
is, really.
For
So
sure. And so for people that don't know what a pelvic health physio does, it's basically anything to do with the pelvis. So a lot of people I treat might have incontinence. They might have urgency, frequency of the bladder. They could have pelvic pain or even hip pain. I treat men, and men I might have prostatitis or have had a prostatectomy. So a prostatitis would be more urgency, frequency of the bladder in a male. I treat women with interstitial cystitis. And I'm trying to think of all the other ones I treat. Pregnancy, postpartum, try to get women back in shape, because that's what happened to me, is that I didn't know what exercises we were supposed to do other than Kegels. And so yeah, there's been a lot of research in pelvic health in the last decade, and hopefully someday Canada will get on board with covering women's postpartum rehab like they do in France and Germany. So yeah.
yeah, and really, do you see women prior to birth as well?
I do. So ideally, it's really a good idea to know what your pelvic floor is doing before you have that baby, so you can prep for birth. So if your pelvic floor is really tight, you want to learn to relax it just prior to labor and delivery, because you need that pelvic floor to relax in order to have that baby. It just makes it easier. If it's weak and elongated, you want to make sure you know how to activate it, because it's a lot harder to learn how to activate your pelvic floor. For example, do a Kegel after you've had the trauma of having a baby. It's just harder to figure out where those muscles are. So always before is better, ideally before you're pregnant, but not too many people are that keen if they're not having issues ahead of time. So yeah.
Yeah, I wish I would have found you 23 years ago when I was pregnant.
I know, it makes such a difference. And I run a Melissa Pinagar, and I run an empowered childbirth course that we do quarterly. And of
Wow.
course, this year we're taking it online virtually. So it's May 24th. But yeah, we just take moms and their partners, through what basically labor and delivery is like, positions for labor and delivery, breath techniques, and what is happening to the pelvic floor. So they have an idea, because I think women are left out in the dark, and then it's not until they're in the hospital, and then they're like a deer in headlights. So the more they know, the better they do. Yeah.
Yeah, I totally understand that. Yeah, that's really great. So when I saw you, I was really fascinated with you talking about soap and what it does to the skin and what it does to our areas. And can you just kind of touch on that and why you really talk about that with women?
Yeah. So Not every woman that comes through my door has issues with her vulva. Like I see a lot of strength issues, so I can assess muscles physically, but I always have a good look at the vulva, especially if someone's complaining about skin irritation or dryness, especially if they're menopausal or nursing, because if you're nursing, you can have a really dry vagina as well. And we are taught as pelvic floor physios vulvar care. And maybe you think, a lot of women think that they're not clean down there unless they use soap on the vulva, but really the best thing to use is water, because the vagina is a self-cleaning oven. So you do not need to use soap down there because it can affect the pH, especially in someone who's menopausal or nursing, because tissues are just drier, which can make them more prone to things like yeast infections, bladder infections, just vaginal irritation in general, which is really uncomfortable if you've ever had it. So that sort of thing.
Yeah, that's pretty awesome. I really, you don't think about that. We just kind of watch TV and watch commercials and kind of do what the big stores are teaching us to do. But I actually noticed that soaps are coming out and body washes are coming out pH neutral now.
Yes, which is better. I mean, like I said before to you, like I do have a vulvar care handout, and if people just have to wash their vulva because it's just in their mind, really it's just in your mind, because you just really need water. But if they are dead set on it because they've done it for many, many, many years and don't feel clean, Cetaphil or Spectrogel are more pH neutral, but still I say just use water, and don't use soap. Things like really fragranced laundry detergents can be really, really strong irritants to the vulva. When I had my own issues down there, I remember seeing a naturopath, and she told me she had a client with a yeast infection that just wouldn't go away, and they did everything naturally. This client eventually went and saw her gynecologist, and the gynecologist said, stop using Tide because it can really irritate. So I'll at least recommend people to wash their undergarments in something that's natural, unscented.
Yeah, that's great advice, Janice. Thank you. Well, thanks. We're going to keep it short and sweet, but how can people get a hold of you if they want to?
They can call me or email me. Or even text me, because the number is a cell phone. So it's 519-386-4443. And my email, which I guess I can leave in the comments, or you can leave it in the comments, is taylorphysiotherapy@gmail.com. So right now I'm not seeing patients in person, but we're doing it virtually. I'm working a day a week just helping out patients that need my support right now until I can get back to in-person visits. So
yeah, that's really awesome. Well, thanks for spending the time with me today, and
yeah,
we'll talk to you soon.
All right, thanks so much, Laurie.
Okay.
Take care. Yeah, bye-bye.